It's week 8 of 2022. I'm Smita Nair. This is your weekly fix. I wonder if you're familiar with this statistic. I wasn't. India lost 419 individuals to suicide every day in 2020, the first year of the pandemic. The figure is comparable to official recorded deaths due to COVID-19 for the same period. Psychiatrist Dr. Soumitra Pathare informs us. The death by suicide figures he points out are in fact an underestimate. Of the 419, 31 were children. Let me say that again. More than 30 children died by suicide every day in the year 2020, an 18% increase from the year 2019. Suicide is the leading cause of death among young people aged 15 to 39 years in India. The data with respect to women is particularly alarming. Indian women accounted for 36% of global suicide deaths among women. According to the Million Death Study, one of the largest studies of premature mortality in the world, 1 out of 77 Indians above the age of 15 years is at a risk of dying of suicide by the age of 80. Yet, there's very little we hear on the subject in public discourse. A new book, Life Interrupted: Understanding India's Suicide Crisis by Amrita Tripathi, Abhijit Nadkarni and Soumitra Pathare is an attempt at correcting that. Let's welcome Dr. Soumitra Pathare, psychiatrist and director, Center for Mental Health Law and Policy, onto the podcast. Thanks, Dr. Pathare, for making the time for us.
Thank you so much for asking me to join. Thank you.
Dr. Pathare, what does available data tell us about suicides in India? Particularly, what does recent data show?
Well, look, first of all, we don't have a lot of data. The only data which gives us a national picture, it has been the National Crime Records Bureau reports which come out every year. And that is the only data that we get on a regular basis. There have been other studies which are done as a one-off study, but the only regular recurring feature that we have in terms of data is the NCRB.
Yes.
And while there are many problems with the NCRB, there are a few facts in the NCRB data which one can reasonably rely on because they seem to consistently keep on coming up. The first fact is that in 2020, this is the year of the pandemic, suicides in India increased by 10%.
Okay.
Now that's, since they're following the same methodology for many years, one would imagine that whatever the deficiencies of the methodology are, they are probably persisting throughout the years. So the 10% increase might be a real capture of the increase. I don't think that it'll be less than 10%, if you know what I mean. It might be more because they didn't capture in their data all of the suicides which happened. So that's one thing which is extremely worrying. And this is worrying because in many parts of the world, especially in the West and in North America or in Australia, suicides haven't gone up during the pandemic. In fact, there's other than Japan, which saw an increase in suicides have not gone up in the pandemic. On the other hand, we know from some previous economic crisis like the 2008 Greece crisis, when suicides in Greece in the subsequent 3-4 years went up by almost 20% or so each year for the next 3-4 years. So clearly, the fact that comes out is that economic crises do cause increase in suicides. Pandemics by themselves, if you take care of the economic crisis, probably do not cause suicides to go up. So one of the things that is extremely worrying is that our suicides have gone up while everybody else hasn't. And this is particularly worrying because India's suicides, makes up about a third of the world's suicides. About 1 out of 3 people who die by suicide is an Indian, while only 1 out of 6 or 1 out of 7 global citizens is an Indian. So as it is, we have a high rate of suicides, and then our numbers have gone up by 10%.
Dr. Pathare, the statistic concerning women is particularly alarming. I read the data and then I shudder to think if this is an undercount, as you point out, as researchers point out, just how high could the numbers be? Indian women die by suicide more often than women in other countries. Indian women account for 36% of suicides by women across the world. Can you talk about this? As also, what is the gender difference in India?
Now, across the world, gender differences in suicide are very well known, but they are actually very stark. So, like in the West, the rate of suicides among men is 4 to 5 times that of women. It's the gender ratio is 4:1, 5:1.
Okay.
In India, that gender ratio has always been very small. It used to be 1.5, 1.6:1, and over the years has gradually been creeping up so that we are now at about 2.3, 2.4 is to 1. Still much less than the rest of the world. Now, why is this gender ratio low in India? Now, one reason could be that less men die of suicide versus more, and that's why you got a lower ratio. Or it could be there are more women dying of suicide, and that's why you got a lower ratio. And I think it's more likely to be the latter. And I'll give you an example of, I'll tell you the data which proves that. If you look at global suicides, then Indian men make up about 24% of the world's suicides. And assuming we are 17% of the world, the difference is 17 to 24. But Indian women make up almost 36% of the world's suicides. So that's like 17% of the world's women versus 36% suicides. So clearly it's more women dying of suicides as compared to the rest of the world.
Right.
If you look at different age groups, the ratio changes dramatically. So under 18, it's actually 0.9, which means there are more girls dying of suicide under 18 than there are boys. Whereas if you look at age groups of 60 and above, the ratio is almost 4:1, which is very close to the Western ratio. So there are 4 times as many men as women dying of suicide. So, the averages hide a lot of differences that exist between genders according to age.
Okay. I'm quoting from your book. In a study conducted by World Health Organization in many countries, including India, 64% of Indian women who had experienced physical violence from their husband or partner had also experienced suicidal ideation. You, Dr. Pathare, have implored the National Crime Records Bureau to specifically investigate the relationship between suicides among women during the period of the pandemic and the experience of violence.
Even before the pandemic, there have been enough studies from India itself, not just from across the world, but even from India, which show that which suggests that about a third of women who die by suicide have a history of having survived violence, physical violence or sexual violence. So 1/3 of women who died by suicide even before the pandemic used to have experience of violence, largely in the domestic sphere.
Right.
So that was something we already always had as a problem. And I think the pandemic has only exacerbated it. There are enough studies now during the pandemic, especially in the early part of the pandemic when everyone was locked at home, which even from the National Commission on Women, I think, and from their national helpline, saying that number of calls for domestic violence went up by 100%, and there was an increased amount of domestic violence happening. So I know at the moment I can't put two and two together because I don't have enough data. But look, the number of calls for domestic violence during the pandemic went up. There is a lot of data showing that domestic violence increased during the pandemic.
Yes.
At the same time, there is now data saying that suicides went up by 10% during the pandemic. Clearly, there has to be some link between the two. And while that's a hypothesis I'm making, and I can only make a hypothesis because I still don't have the data, that is the problem, that the NCRB does not actually release the raw data. If you wanted to do some analysis on the census data or on the NFHS data, for example, you can go to the website and download the raw data. You can run different kinds of analysis on it on your own. And it's all de-identified data and you have the raw data to work with. Unfortunately, the NCRB doesn't release raw data. So I have no raw data to be able to make those linkages. And the NCRB itself does extremely very simplistic kind of analysis. Where it assumes that there is one factor leading to suicide. So, for example, I mean, and that's a problem with their data, is how do you classify what is the cause of suicide? I mean, I'll give you an example. Let's say there is a woman who dies by suicide, okay? And let's say she has a history of domestic violence, and she's also being treated for depression. Now, how does NCRB decide in which category will they class her death as by suicide? Will they class her in the category of, oh, mentally ill person who died by suicide? Or are they going to class her as domestic violence and died by suicide? Because you see, they don't put two causes.
Right.
Every case of suicide is attributed to one single cause. So they don't have categories where they can say, oh, but this person would fit into both the categories. They won't do that.
And another issue with the data is that the NCRB does not take into account attempted suicides, right?
That's the bigger worry. The NCRB data tells you about suicides. It doesn't tell you about attempted suicide because no one collects data on attempted suicides. And across the world, attempted suicides are anywhere between 5 to 20 times the total number of suicides. Now let's take even India's number of 150,000 that NCRB came up with, but which, if you go by the WHO figures, is probably 250,000. But let's take the 150,000. If you multiply that by 20, then that gives you a very high number. It gives you a number close to 3 million or so, which means there are about 3 million attempted suicides in the country every year, and we don't really do much about it. Now, why is this important? For two reasons. One is attempted suicide is one of the best predictors of a future suicide, a future death by suicide. So it's actually one of the best predictors. It's the place where you can intervene and try and prevent death by suicide in the future. And the second thing is the economic costs of healthcare that is required for attempted suicides. It results in all kinds of issues and pushing families into poverty. So again, attempted suicide is something that we should be talking much more about than we do at the moment.
Now you've repeatedly spoken about what you call the disinterest of policymakers in understanding suicide beyond the narrow prism of mental ill health. In the book, you talk about the sense of helplessness you felt as a young psychiatrist when you came across the case of Mala.
Mala is it's a pseudonym that I use, but it's a true story from 20 years ago when I first started practicing as a psychiatrist in India after I returned from the UK. And she was somebody in the large general hospital that I worked in. She was one of these people who had been admitted with a overdose, and she had swallowed some some of these insecticides or pesticide kind of stuff, and so she ended up requiring an intensive care. And so, although she came from like 100, 200 miles away from Pune, her care had been transferred, and she was admitted to a hospital in Pune. In the hospital where I worked, and the challenge with Mala was that as a psychiatrist, when I was asked to see her, the challenge is that Mala had attempted suicide largely because she had been sexually abused by her brother-in-law.
Okay.
And the reason she had been sexually abused by her brother-in-law is because she and her husband were trying to have children and failing to have children. And after they had been to the doctor, it turned out that her husband was sterile. And so, this was something, and this is something that one picks up as one listens to it over time, and you can read it in the book. And immediately after that event, when her brother-in-law tried to force himself on her, that within a few hours of that happening, she had attempted suicide.
Okay.
The worrying bit for me was that after all of that, when she was being discharged, she did not want to report this to the police. She did not want this made a fuss of because, as she put it, she had younger sisters who had to get married, and if anything like this happened, then her her sisters would not get married.
Hmm.
So, this raises a whole host of issues, structural issues about sexual violence, about gender-based violence. Uh, the fact that while everyone says, oh, well, women can complain, women can complain, but is it feasible to complain if you've got social structures where she has to also worry about the fact that she's got younger sisters who need to get married? And unfortunately, I could never see Mala ever again because the family had given a wrong address. So a month afterwards, when we were trying to look for her for follow up, we couldn't find her. And so I don't know where Mala is, if she's alive, if she's got children, is she happy, is she divorced, is she still with her husband? I have no idea. She would be in her late 40s if she's still alive.
Hmm.
But for me as a clinician and as a psychiatrist, it kind of brought home the sense of helplessness that came with it. That as a psychiatrist, there was very little that I could offer her.
Hmm.
Clearly, telling her why don't you take antidepressants is not going to be a solution.
Right.
And she was not depressed. I mean, the event happened in the evening, and 3 hours later, she took an overdose. That's not depression. That's grief, and that's normal grief.
Right.
And why would an antidepressant help her anyway? So giving her or telling her why don't I send her to my counselor and giving her counseling is not going to solve the problem. I mean, what do you counsel her? She's been sexually abused. How do you counsel her, and what do you counsel her without actually addressing the issue of sexual abuse? You can't be counseling her without actually then doing something about the abuse that has happened, but which she did not want anything done, and which the family were not willing to. And also they just disappeared. So it's that whole sense of helplessness which one lives with for the rest of one's professional career.
Right. Dr. Patari, I found the chapter Not Too Young to Die particularly distressing. I'm reading from your book. Suicide amongst children under 18 years rose from 9,613 in 2019 to 11,396 in 2020, an 18.5% increase, nearly double that of the increase in the total population. This is a significant spike in suicides in young people. How can this be explained?
Now that is extremely worrying,
Yes.
and it's particularly worrying also because if you look at the suicides because of exam failures, the suicides due to exam failures in 2020 went down by 24%.
Hmm.
So while the suicides due to exam failures are down by 24%, the total number of suicides in children is up by 18%. When the global number of increase is only 10%. So clearly extremely worrying kind of data there. The absolute number 2020, that translates to like 30, 35, 32 children every day dying by suicide. Now that somehow seems to have not created any kind of public uproar, which is extremely worrying because, if there are 30 kids dying of suicide each day, you would have thought that our communities would actually talk about it or want something done about it.
Yes.
So why am I saying this? Is because this has been the state of affairs. The previous year it was 9,000. The year prior to that it was 8,500. So that's the kind of numbers that we have over so many years now consistently.
Hmm.
And nothing has happened. In fact, if you, again, this is a good example of how public discourse has not really kept up to date with the facts and figures and data. So if you ask the politicians, or if you ask public policymakers, or you ask the general public, why would children under 18 die by suicide? And the standard answer, you will get the immediate first answer they'll give you is that, oh, it's all this exam pressure, exam suicides. Exams are what are causing suicides.
Hmm.
Which is true, which is not completely untrue. But look at the data properly, okay? Exam suicides only account for about 10% of the suicides. They don't account for more than that. So they don't account for 90% of the suicides. Because if they did, the number of suicides in 2020, for example, exam suicides went down by 24%. Okay, while the total number of suicides went up by 21%. So clearly exam suicides are a factor, and the fact that in 2020 we had school closures, and so you didn't have exams happening, and so suicides went down. It's a very good exam. It's a great proof, in a sense, a proof of the pudding, so as to speak, that clearly our examination system and our academic system does push a number of young people and children to suicide. So that is not a debatable issue, and clearly putting in some kind of policy changes will make a difference. You see, again, there the standard response has been, which is what worries me, is like the standard response that has come from governments to that is that in the month of June and July, when there are exam results, they open up these helplines. They say, oh, we'll have helplines. If any kids are feeling distressed, then they could call up and we'll hopefully save lives. Whereas if you actually look at what has made a difference and saved lives has been policy changes in the education sector. And the Tamil Nadu example is a good example of that. My friend, Dr. Lakshmi Vijay Kumar, who's a very well respected international suicide prevention expert. Lakshmi has been running a suicide prevention helpline for close to 30 odd years. And they noticed that, they were getting these increased numbers of suicide during that exam results period, and they looked at it and analyzed, and they realized that it was largely happening to people who either expected to pass and failed by a few marks, or expected to get very high marks and got much less than what they had got. And so, Lakshmi and her team really mounted a public campaign and lobbied the government in Tamil Nadu, which then started this idea of supplementary exams. So that, the month in which the results come out, they hold a re-exam in a sense, which you can sit for, and then either pass it or even improve your scores, and you can then continue ahead.
Okay.
And just that one step reduced the number of suicides over the last 10 years. The number of suicides in Chennai, where they've got some data for, have come down by 50%. Now, in the last 10 years, the number of students taking the 10th and 12th board exams has doubled. But suicides are down 50%. So that's a dramatic change, that a small policy change in education could reduce suicides by a dramatic number.
Okay. Evidently, addressing suicides isn't just about mental health interventions.
I'm not at all suggesting that we don't need mental health interventions. But what I'm suggesting is that actually we also need interventions which are outside of mental health, which will address suicides. And broadly, to try and, the point I'm trying to make and get our community to understand is that suicides are not purely a health problem. They are a public health issue, fine. But the drivers of suicide are not primarily in the health sector.
Yes. Dr. Pathare, that brings me to what Divya Kandakuri, journalist and founder of Blue Dawn, talks about in the book. This is from the point of view of individuals from marginalized groups seeking mental health help and finding that there exists a big gap in the understanding that healthcare professionals have of the structural and systemic issues of caste, for instance, that have a direct impact on mental health. Allow me to read from what she's written. When Sushant Singh Rajput's suicide happened, the whole country said it's nepotism. Everyone spoke about nepotism for those 4 or 5 months. But when Rohit Vemula died, people said he was depressed. When Payal Tadvi died, they said she was depressed. When Anita from Tamil Nadu died, people said she was depressed. When this one Rajput man dies, everyone started becoming progressive about mental health and said that suicides happen because of the system. But when students from marginalized communities have been dying, everyone says that they died because they were depressed. When they can quote nepotism as a reason for suicide, how hard is it to quote casteism too as a reason for suicide? She goes on to talk about how so many therapists either seem unaware of the reality of caste oppression and how it manifests as trauma, or, as in many cases, the therapists themselves are inherently casteist.
I mean, look, the unfortunately the discussion on caste in our society has been narrowed down and is only focused on reservations.
Yes.
Oh, that's the whole problem. Reservations and caste. You say caste and ask people to do a word association test, which is like, if I say caste and say to you, give me a word, The average person in the street, or especially average professionals, will only talk about reservations.
Right.
So, we've reduced the discourse of caste down to reservations rather than look upon it as a structural disability that is caused by our society, and that reservations is actually attempting a treatment on that structural disability. So we start blaming the treatment for the problem, rather than actually addressing the problem. And look, there is enough data and more to show that whatever Divya is talking is actually true, because the vast majority of clinicians, mental health professionals, doctors, nurses, psychologists, counselors, do come from the Savarna community. There are huge numbers of them. And so they would have very little lived experience of experiencing caste discrimination. See, if you don't have, imagine, like, it's like a white man in the US saying that I have never experienced racism. Well, a white man in the US doesn't experience racism.
Yes.
It's the black or the Asians who experience racism. So for a white man to glibly say, well, there is no racism, nobody's ever made a racist remark to me. And that's the equivalent that you get here, which is people say, well, I have never heard any casteist remark. Nobody's ever talked any caste to me. Now, in that sense, you have to belong to the Savarna community because you're privileged enough that caste is not a bother for you.
Right.
Look, we know that violence leads to suicide. We know that discrimination, experiencing discrimination does negative things to your mental health and puts you at risk of depression and suicide. So why wouldn't caste discrimination and caste-based violence that is experienced by the DBA community not be the cause of suicides or mental health problems?
Indeed. And there is more food for thought that Divya Kandukuri provides in the book, as do you, Dr. Pathare, and your co-authors, Dr. Abhijit Nadkarni and Amrita Tripathi. I do appreciate you taking the time to speak to us, Doc.
Thank you. Thank you. Thank you.
Thank you.